The president's budget request includes deep cuts to healthcare programs. Budget reconciliation churns forward in Congress. And the HHS secretary finally agrees on a date to testify. For the week of May 5th, 2025. From Capitol Hill in Washington, D.C., this is Health on the Hill, brought to you by Heart Health Strategies. I'm Matt Duckworth.
The committee will please come to order. A quorum is present. The committee meets today pursuant to notice. Today we'll consider the committee print to comply with the reconciliation directives included in Section 2001B3 of H-Con Res 14, the concurrent resolution.
Kicking off this week's episode with news from Congress, where both chambers returned from a 2-week recess last week and began marking up parts of the budget reconciliation package containing the spending and savings directives from the fiscal year 2025 budget resolution adopted in early April. 6 House committees, including Oversight and Government Reform, Judiciary, Homeland Security, Armed Services, Education and Workforce, and Transportation and Infrastructure, held markups last week of their specific reconciliation instructions. The Education and Workforce package includes provisions to cap student loan amounts, $50,000 for undergraduates, $100,000 for graduate students, and $150,000 for students in professional programs, and revise student loan repayment policies. Republicans aim to use the reconciliation package to advance President Donald Trump's domestic policy agenda, including tax cuts, energy policy, and border security, while trimming the budget deficit by at least $1.5 trillion. House Speaker Mike Johnson is targeting the week of May 19th to hold a vote on the assembled package on the House floor. The House Energy and Commerce Committee is instructed to produce approximately $880 billion in savings over the next decade, which is expected to necessitate cuts to the Medicaid program. Committee Chairman Brett Guthrie, a Republican from Kentucky, estimates that health care provisions could account for $500 to $600 billion of the panel's deficit reduction target. Negotiations between committee Republicans, GOP leadership, and the Trump administration are ongoing as policymakers work to reach an agreement around the details of Medicaid reform. Republican leadership is insisting that changes to the Medicaid program can be accomplished without cutting enrollee benefits for the most vulnerable populations. Proposals that may be under consideration include cutting the tax levied by states on providers and hospitals to generate Medicaid funding, reducing Medicaid expansion states' enhanced federal match rate, adding federal work requirements to the Medicaid program, mandating more frequent Medicaid beneficiary eligibility checks, excluding non-citizens from Medicaid program eligibility, per capita caps on Medicaid funding for expansion state enrollees, and lowering the federal Medicaid matching rate for the District of Columbia. The White House has also held discussions about the idea of pursuing a most favored nation policy, linking the prices paid by the U.S. government for certain pharmaceuticals to the lower prices paid abroad, as a possible alternative for generating the savings necessary to help pay for the reconciliation package. Chairman Guthrie has delayed the Energy and Commerce Committee's markup on its portion of the reconciliation bill to the week of May 12th. The panel had initially planned to meet on May 7th. A bloc of moderate Republican lawmakers remains wary of making drastic changes to the safety net program. Representative Don Bacon, a Republican from Nebraska, for example, has stated that he will not support legislation with more than $500 billion in reductions to Medicaid. GOP leadership will have to balance the concerns of these members with the insistence of at least 20 more conservative Republicans that deep cuts to the Medicaid program are crucial for reining in the federal deficit. With a 7-seat majority in the House, the GOP can lose no more than 3 Republicans if all members are present and voting. in what's expected to be an otherwise party line vote. Shifting into news from the administration today, where the Trump administration released its fiscal year 2025 abbreviated or skinny budget request on Friday. The administration's full budget request to Congress will be released at a later date. The budget proposes to cut $33.3 billion in discretionary funding from the U.S. Department of Health and Human Services, a 26.2% reduction compared to current spending. This includes a $3.6 billion reduction in discretionary funding for the Centers for Disease Control and Prevention and an $18 billion reduction for the National Institutes of Health. The Make America Healthy Again initiative would be funded at $500 million. On Capitol Hill, the president's budget request is understood as a signal of the administration's priorities and spending targets for the coming fiscal year, rather than an actual legislative proposal. Senate Appropriations Committee Chair Susan Collins, a Republican from Maine, has already expressed, quote, serious objections, unquote, to the budget's proposed cuts to biomedical research, which she and other senators voiced during a hearing she chaired last Wednesday titled Biomedical Research, Keeping America's Edge in Innovation.
Today's markup is yet another important opportunity for our committee to advance legislation that supports the most vulnerable Americans by reauthorizing key programs to combat substance use disorder and safeguarding seniors' access to prescription drugs. We reaffirm our commitment to strengthening our healthcare system and expanding access to care for patients and their families.
On Tuesday, the House Energy and Commerce Committee advanced 6 healthcare bills to the full chamber. Those include the Support for Patients and Communities Reauthorization Act, which was reported by a vote of 36 to 13. Several Democrats who voted against the typically bipartisan bill cited concerns about recent layoffs at the Substance Abuse and Mental Health Services Administration. Certain Support Act programs lapsed at the end of fiscal year 2023, and reauthorization of the law was dropped from the initially proposed bipartisan year-end spending package in December of 2024. Other bills included the Charlotte Woodward Organ Transplant Discrimination Prevention Act, which was reported by a vote of 46 to 1. The Women in Lung Cancer Research and Preventive Services Act, which was reported by voice vote. A bill to amend the Public Health Service Act to reauthorize the Stop, Observe, Ask, and Respond to Health and Wellness Training Program, which was reported by a voice vote. The Chandra Isinga Human Cell and Tissue Product Safety Act, which was reported by a voice vote, and the Seniors Access to Critical Medications Act, which was reported by a vote of 38 to 7. Last week, Republican members of the House Ways and Means Committee sent a letter to the Centers for Medicare and Medicaid Services, outlining their priorities for the Center for Medicare and Medicaid Innovation, or CMMI. The lawmakers urged the agency to focus on payment models that save money, improve transparency and communication around changes to existing models, ensure solicitation of stakeholder feedback in the development of new models, and renew attention on improving rural health care. The letter details the lawmakers' concerns with CMMI's failure to develop value-based payment models that improve care quality and reduce costs to the government. The letter states, quote, "We believe with the right leadership, CMMI can produce models that promote value over volume, result in meaningful program savings, improve care for the most vulnerable beneficiaries living in rural and underserved communities, and better incorporate public input." Unquote.
Roll call vote. Before we begin, I'd like to let our departing ranking member Jerry Connolly know that everyone here is praying for him. Our thoughts are with him and his family. It's been a pleasure to work with Jerry Connolly. We don't always agree.
Representative Jerry Connolly, a Democrat from Virginia, announced his decision last week to not run for re-election and to step down from his position as ranking member of the House Oversight and Government Reform Committee. Connolly has been battling cancer of the esophagus since late last year. He's served in the House of Representatives since 2009. Winding down today, where the Government Accountability Office has released a new report on the Inflation Reduction Act's Medicare drug price negotiation program. The report describes the Centers for Medicare and Medicaid Services implementation of the negotiation program and the inflation rebate program, and assesses CMS's plans for using funds for both programs. The report includes details about how CMS spends money on activities such as program support, administration, and outreach and education efforts.
Well, I think the NIH, as I said, 80% of the money goes to universities and labs across the country. They're fundamentally partners in the scientific enterprise that the NIH is engaged in. The job of the NIH is to make sure that money actually serves the needs of the American people. And so focusing the money at universities so that...
Final news today, where the director of the National Institutes of Health, Dr. Jay Bhattacharya, who you just heard, announced his decision last week to move up the implementation date of a recent change to the NIH public access policy. The 2024 change, which will make NIH research findings freely accessible to the public without the previously installed one-year embargo period, was set to go into effect on December 31st of this year. It will now be effective as of July 1st. Bhattacharya stated, quote, "Earlier implementation of the public access policy will help increase public confidence in the research we fund, while also ensuring that the investments made by taxpayers produce replicable, reproducible, and generalizable results that benefit all Americans," unquote. We end each week's episode with the Call to Order, where we lightning round congressional meetings and hearings in the near future that you need to know about. First, on Monday, May 5th at 3 p.m., the House Veterans Affairs Subcommittee on Technology Modernization holds a hearing titled Improving Access to External VA Care Through Enhanced Scheduling Technology. Second, on Tuesday, May 6th at 10 a.m., the Senate Finance Committee hosts a hearing to consider the nominations of James O'Neill to be Deputy Secretary of Health and Human Services and Gary Andres to be Assistant Secretary of Health and Human Services. Third, on Tuesday, May 6th at 10:15 a.m., the House Veterans Affairs Committee holds a markup, including multiple health-related bills. Fourth, on Wednesday, May 7th at 10 a.m., the House Budget Committee convenes a hearing entitled The Fiscal State of the Nation. Fifth, on Thursday, May 8th at 9 a.m., the House Appropriations Committee gavels in an oversight hearing on the Cybersecurity and Infrastructure Security Agency. Sixth, on Thursday, May 8th at 10 a.m., the Senate Health, Education, Labor, and Pensions, or HELP Committee, holds a hearing on the nominations of James O'Neill to serve as Deputy Secretary of Health and Human Services and Jeanette Neshawat to serve as Surgeon General. And last, on Wednesday, May 14th at 1 p.m., the Senate HELP Committee hosts a hearing on the fiscal year 2026 Department of Health and Human Services budget, featuring U.S. Department of Health and Human Services Secretary Robert F. Kennedy, Jr. Thanks again for tuning into this week's episode of Health on the Hill, brought to you by Heart Health Strategies. For more information on this week's healthcare happenings in the administration and on Capitol Hill, you can visit our website at hhs.com and click on the news section at the top of the page. You can subscribe anywhere you get your podcasts, including Apple Podcasts, Spotify, YouTube, and SoundCloud. Did we miss a story you wanted to hear this week? If so, email me at mduckworth@hhs.com, and we may include it in our next episode. Have a great week, and stay healthy.